puts out there, either from when you're forming, the research questions, designing the research to be done, and eventual implementation. So ethics is at the heart of what CDC does in its day-to-day activities. But bringing closer now to the specific question that I've been asked about how are we meaningfully and ethically engaging youths to ensure they are on the table for co-creation of the programs. One, the way CDC works in the country, we do not work alone. Yes, one, we work as key stakeholders working with government, especially the Ministry of Health, where we are convened to the table with the Ministry of Health, design the programs, and then also support the implementation of those programs by providing funding to those programs. So some of the ways we are involved or we engage young people is we have various programs that we've carried out. For example, if you look at the treatment program, we have our OTZ program. Again, that is really a program that sees young people more of an asset. If you're upstairs in the morning, there was a presenter talked about capacity building and capability. Yes, and that program realizes that the youth, the young people, have capability and provides with them a platform to make good decisions and informed decisions about their health, and especially those receiving treatment. And that we've seen having very positive outcomes for them in terms of them remaining on treatment, them achieving good outcomes of treatment. But that's not enough so far. Going forward, we are still seeing a gap that we really now want to aggressively work. Again, like I said, working with government and other stakeholders. Now to answer the question is, how do we bridge the gap about HIV prevention knowledge first? Knowledge. Because at the heart of science, it's been demonstrated, once an individual has the right information, once an individual is empowered with the right information, then they can make an informed decision and choices about their health. Again, looking at what Dr. Were shared in terms of some of the approaches they're doing to make some of the prevention services available, whether it's online or away from the health facilities, but it starts with knowledge. So what we are looking forward, again, working with the Ministry of Health, is to engage the youth in the different counties where we have what we call our implementing partners. So for example, if you go to Kiambu County, you might not meet me as Jonathan, but you'll meet one of our implementing partners called LVCT Health that works there. If you go to Nairobi, for example, you'll find there's an organization called CHEB Connect that we work with. If here in Mombasa, there's, I think, Stawisha. It's a USAID funded program. So in those programs, we want to involve the youth in terms of how do we design programs or channels where, one, the prevention messaging can be passed in language that we understand, yes, in platforms that are readily available to us, be it TikTok, be it, I was told not Facebook, be it radio, be it TV. You'd be surprised. We had thought, radio and TV had gone, but fun enough, from a survey recently, radio and TV are still, relevant. So how do we design those programs? So yes, we would want to engage now the youth, going forward, one, in designing those messaging in terms of the appropriate language, the appropriate media, so that number one, we empower them with the right information. And then now number two, working with government and other regulators now to avail the services in non-traditional areas. Non-traditional areas would mean, for example, if you need to access condoms, if you need to access PrEP, you have to go to the health facilities. Are there other opportunities for you to access those prevention services that are in keeping with the other regulators? So we have to work with them as well, so that once you have the right information, then you're empowered, then you can make the decision, then you can access the services. So that's how essentially that we work. That one, we do not work alone. We work as key stakeholders, working with government and other stakeholders. One, to co-create these programs. Two, and to support the implementation by providing funding and also providing some of the commodities that we see being consumed. So yes, we are looking forward to those conversations. And remember, I've said this should happen at different counties because again, we've realized it's not a one size fits all. Yes, that there are unique settings, there are unique geographies, and there are unique characteristics in all these different settings that we would want to respond and be responsive to. So at your respective counties, we would want to engage with you, again, through implementing partners, because they also have a provision. I think a very good point has been made that we should not only see young people as volunteers, but also meaningfully and gainfully engage the youth. So again, at that level, if they're organized groups, we do have provisions of providing what you would call either sub-grants or just small engagements as part of the larger grants, so that you can bring on the table the ideas of how do we package the messaging, what medium do we use to reach you, and then how do we provide the services to you. Thank you.
Thank you so much, Daktari. And I think a key takeaway is the brains are here. Si tuko hapa?
Absolutely.
Ideas ziko kwa fingertips, ndio? So we are happy to help. Happy to share more even with CDC. Hata a CDC advisory youth panel, si idea mbaya, si ndio? Mama aje, si ndio? Kila mtu kwa kaunti moja, si ndio? Wanaenda wanakaa pale hivyo juu. Makofi, wewe! Tunamtuma huko kwa wale wakubwa. So thank you so much, Daktari. And of course, we recognize the amazing work that you're doing. So over to Israel. Israel is a social worker. Social worker ni watu wa maana. Do we agree? Yes. Sana, si ndio? So Israel, please shed some light about how you're working with young people as a social worker. How are you reaching young people? Sometimes as young people unapatana na madhe ndo anakupatia information but bado anakuambia unafaa usome. So it makes sense bado. So you as a youthful social worker, how are you reaching to young people? How are you ensuring that young people are able to access information, the support, and even referrals at the community or even at the facility level?
Thank you, Jerop. Allow me to start the way I've mentioned. As a social worker, I help people to help themselves. So generally, as PS Kenya, we have been implementing program on HIV self-testing, and this program scaled up into the private sector. I think, and some of the reasons why we took the total market approach are the reasons Dr. Wele presented: issues around stigma, privacy, and confidentiality. So how we involved young people in the design of this program, we conducted a market research. From the year 2019 going forward, actually we have seen penetration of HIV self-testing kits in the market. Nowadays, you can just walk in a pharmacy, purchase a HIV self-testing kit, or order a kit through online pharmacies such as Maidawa. But what remained unanswered was if people were aware on how to use these kits and assistance with next steps, that is linkage to treatment and other support services. So we involved young people, and here we targeted youth of ages 18 to 34 in a market research which was entitled Identifying Barriers and Motivators to Uptake of HIV Self-Testing in the Private Sector. So we interviewed young people to tell us what are their barriers and what motivates them to use or to uptake a HIV self-testing kit. And it came clear from the market research. We identified the prominent barriers. Some are fear of reactive results. Youth, they fear, what if I got a reactive result? And that was a prominent barrier. To some extent, it might stop someone buying a HIV self-testing kit and getting the opportunity to know their results. Another barrier was the preference to being anonymous. Young people, they don't want to be seen like, I have purchased a HIV ticket. There are some privacy and confidentiality concerns, especially to the people known to them. It came clearly from the market research, like a young person will likely to travel maybe from Mombasa to Kilifi to purchase a HIV ticket, and at the same time, we have someone offering the same services in Mombasa. If I pose a question to you, how many are likely to purchase maybe a condom from a pharmacy operated by your aunt?
Kubaya. Ni mbaya.
So that came clearly from the market research, especially when it comes, this person knows me. There's no way I can purchase a HIV ticket, a condom, or any SRH product from the providers who are known to me. So this was also a barrier to uptake of HIV tickets and to an extent the SRH products. So we identified the barriers and motivators across the journey for the young people who are our target audience. What motivates them to purchase the kit? Young people told us endorsement from peers. Like, my friend can tell me I have used this kit, and that's an opportunity for you also to use that kit. From purchase to use, what motivates you to use? What are the barriers to usage? Some are telling, I don't have information how to use. So lack of guidance on how to use the kit. When it comes to reporting, not every youth was willing to report their results. So we identified the barriers, motivators across that HIV stage, and from the purchase, use, knowing your results, reporting, linkage to treatment, and other support services. After the market research, we now utilize the human-centered design. We brought all human perspectives as part of the process, now to come with the solutions to address the barriers which came out from the market research. So during the human-centered design, together with the young people, we synthesized the insights that came from the market research and came up with 3 main solutions to address the barriers to HIV self-testing kit among youth of ages 18 to 34. And at this stage, we also included the male of 35 plus, because from the market research, it came clearly young girls are engaging in sex with the males, wababa. Is that true?
Guys,
So at some point, youth told us, in this design, you can't only target the young people.
Yeah.
You are forgetting this wababa. So that's how impactful these young people are. They have information in which, as programmers, we may not be aware of. So in the human-centered design, we came up with the 3 main solutions. If you can remember, the most prominent barriers were the fear of reactive results, stigma, and being anonymous. So youth told us, like, we need, if I were to get services from Dr. Jonah, if it's Dr. Jonah offering those services, I will not go for those services. But if there is a way I can personalize Dr. Jonah, but it's not just Dr. Jonah, just personalizing to meet my preference, I can go for such services. So we came up with how might we question of how might we emotionally support these young people before, during, and after using a HIV self-testing kit. Youth brought up the idea of having a digital counselor to support them across the journey. So this digital counselor is not a person, but it's just a personification. Like, it can inform you where you can purchase this kit, it can assist you with usage, and it can link you to other services, be it a hotline number in case you need someone to talk to. On the whole issue of stigma and the stigma surrounding HIV kits, youth told us they need to manage their health-related concerns. And if I can recall, young people were of idea like purchasing a condom nowadays is not a big concern. Is that true? What about a HIV ticket? How many of us are confident enough to purchase a HIV ticket in a pharmacy? Confident, or situations force us?
situations. Ikiharibika.
Kukiharibika, we have the confidence. So the whole idea of destigmatizing HIV as tickets, youth told us there is need like, let us not speak about HIV as ticket. Let us take it more of as a package, what Dr. Were suggested. So we came up with a strategy to destigmatize HIV as tickets in a pharmacy. In that, whenever you go to a pharmacy, you are likely to see a product sold together with another product, just to destigmatize it. And we were looking at the public health impacts. In that, we trained the providers. If a person comes to purchase a condom, especially on a Friday, Saturday, whereby they're recording most sales of these products, this provider may engage you to know your HIV status. And key talking points for the pharmacies here were to speak with the young people and encourage them. So we brought the idea of the providers empowering young people not only to prevent themselves, to not only to know their HIV status, but also prevent themselves. In that, whatever starts with the test, actually prevention is the best. And to enhance that anonymous experience for the purchase moments of HIV and other SRH products, we worked with online pharmacies to deliver these HIV tickets. So that was more about getting the services back to the end users, and we piloted these 3 main solutions for a period of 15 months. And from our design and awareness creation, actually we have learned that innovative social behavior change communication works for the youth, and more young people can be reached with HIV information through digital marketing. Is that true? Like if you want to target young people, we may have to utilize digital marketing as well as other traditional demand creation. Here what I mean is you target where youth are. Like in Nairobi, just to create awareness on HIV and the need for young people to know their HIV status, we have been leveraging what we can call concerts and social joints. So you see like Radio Maisha is organizing for a Choma na Ngoma festival. We have program teams there, the private sector, taking these services to the user. Now that you don't find these services in a pharmacy, but you find them in a platform whereby umeenda tu kujibamba. And what we learned, actually, people can purchase these products during these events. Is that true? You are likely to purchase a HIV ticket when you find it in a concert being sold compared to a pharmacy. So that is what we learned. And while generally young people are aware of HIV tickets, but the need for most anonymous experience is what hinders them to uptake of these kits. Also on support to linkage, I think I have mentioned about this youth fear being seen in their communities. So there is need to come up with digital investment and solutions that personalize and enhance experience for consumers. So we have been majorly involving young people in designing these solutions, and some of these solutions work for them, while others we have just to call the youths